Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Iain Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Hello, everyone. Today we are reporting 14 new cases of COVID and 9 recoveries, more than yesterday, but only one of those is under investigation. Our hospitalization numbers are staying low. We have 6 people in hospital and 3 in the ICU. It shows again that we are on the right track and that we need to stay focused. As of today, nearly 69% of Nova Scotians have received their first dose of vaccine. Our second dose rollout strategy is now moving along nicely. This week we are administering about 80,000 doses. And I wanted to mention that tomorrow we'll receive a significant boost of doses of Moderna, and that's in addition to the Pfizer delivery. Our clinics will be adding late hours and we'll be ramping up even more. So that's all good news on the vaccine front, and Dr. Strang will have more to say about that. Yesterday was a big day for our province. We moved to phase 2 of our reopening plan. And I know many Nova Scotians have gone out to take advantage of this. And as you can see behind me on the monitor, just how much. These are some great shots from Communications Nova Scotia to showcase what the first day of our phase 2 reopening plan looked like. It's really exciting. Looking around the city and in my own constituency, I saw many people getting out to see friends and family, people visiting restaurants, retail outlets. I was at the gym this morning. Good to see people back out working out. I've heard that the tourism operators have noticed a dramatic increase on their website traffic, and this is also great news. It's good to see Nova Scotians and our province and our economy recovering again. Continue to support your local businesses and consider booking a staycation in Nova Scotia. Now, keeping with the reopening theme, this evening I'll have a meeting with my fellow premiers and the Prime Minister, and on the agenda is the issue of vaccinations credentials. So I'm eager to continue to talk about that as we look at our next phase of our reopening plan and look what other provinces are working on at the same time. All provinces are focused on their vaccine rollouts. This is how we further reopen our economy as our vaccination numbers increase. And let me conclude with this. It is so important in this fight with COVID, and I keep saying this, is to continue to get tested. We had a really positive day yesterday with about 6,000 tests conducted. So way to go, Nova Scotia. Even when our case numbers are low, testing is key. It pulls back the curtains back on whether there is a possibility of community spread. And it also allows us to track cases if there is known contacts to stamp out the COVID virus when we can. So I'll turn it over to Dr. Strang, and I must say it is difficult to keep up with this tie game, but it makes it easier when people send us matching ties.
Thank you, Premier, and good afternoon, everybody. And yes, the Premier and I are wearing matching ties today in honor of the 2nd annual Long-Term Care Pride Day to acknowledge the phenomenal work that staff in long-term care facilities do. They certainly have been an integral part of caring for long-term care residents throughout the pandemic and helping to reduce the spread of COVID-19 in our facilities. So once again, thank you to all long-term care staff. As the Premier said, we have 14 new cases today, and it's not surprising that we are still seeing new cases. What we are watching for is whether they can be connected to a known source of infection, and in almost all of our new cases, they can. I will note that in the last few days, our newer cases are having more contacts. This is not unexpected, given that we are opening things up, but it's a good reminder that while we cautiously open, people need to limit the number of close contacts that we have, keeping them small and keeping them consistent. Testing volumes have increased a bit this week, and I hope we can keep that up. As the Premier said, we need to. It's critically important to continue to test as we reopen. Even if people have had 1 dose of vaccine, they need to continue to have a regular test for COVID over the next number of weeks. It's important that we're able to have a good handle on where we might have virus throughout our province. Yesterday was the first day of phase 2, and as you saw some of the pictures, and social media is telling us that people were happy to return to things like indoor dining and the gym, and we encourage that. We encourage people to shop locally, use local restaurants, but we also need to do that carefully. So most of what I'm going to talk about for the rest of my update today is about our vaccine rollout. We are making great progress. 69% of Nova Scotians now have one or more of those doses, and I'm starting to figure out what tie I'm going to wear when we celebrate hitting our minimum target of 75%. The majority of the vaccine we are receiving is delivered through our 10 community clinics and our several hundred community pharmacies. We are working with partners to create unique delivery approaches for a variety of communities and groups. We have drive-through clinics and clinics in First Nations and African Nova Scotian communities. We're vaccinating in transition houses and homeless shelters. And we've gone to day programs for adults with disabilities, and this week we launched a wider in-home vaccine program for people who cannot leave home for medical or other reasons. Our central booking system has every appointment in one place. There have been a few glitches, but overall it's easy and convenient to book an appointment online or by phone. We're one of the few provinces that has this, and there's a key piece that our central booking system will allow us is we can very carefully track and invite people for their second dose of vaccine. And so we're going to be one of the few provinces that can actually have a good handle on who's getting their second dose vaccine and where we direct our efforts. Provinces without this central booking have very little or much less capacity to have that direct view of how their second dose program is rolling out. There has been a lot of talk this week about the progress of our vaccine on second doses. Our priority at the start of our rollout was getting every eligible Nova Scotian a first dose, focusing on our oldest citizens and a few priority groups first, including healthcare workers. And our rate for first dose delivery is higher than the national average. So while we keep pushing first doses, we're also getting more focused on the second doses. We are now inviting people to schedule their second dose appointments earlier based on when they received their first dose. Right now, anyone who received their vaccine on or before May the 1st can book an appointment to get their second shot. In most cases, it's 3 to 5 weeks earlier than originally scheduled. 200,000 Nova Scotians have been invited to move their appointments up, and 75% of them have already done so. Our original goal was for everyone to be fully vaccinated by mid to late fall. But as supply has firmed up, the interval between doses shortened, and we learned about the interchangeability of vaccines, our plan has shifted and target dates have changed. Last week, we learned that Nova Scotia would get a large shipment of Moderna vaccine, and yesterday we learned that the Pfizer supply we expected in July would be reduced. And so we're shifting again. Over the next few weeks, we'll get more than 400,000 doses of vaccine. This is a dramatic surge in our supply and well above the maximum we anticipated. But ultimately, it's a game changer. Everyone will get their second doses much earlier than originally scheduled. Planning is underway, and we'll have more concrete information in the days ahead. Well, people need to know that this is no small feat. It means expanding everything we're doing, longer clinic hours, more people, possibly more clinics, always with a view to what more we can do to get people vaccinated. The vaccine team has been working non-stop since learning of the Moderna shipment. Our goal is to get it out as quickly as possible while maintaining quality and safety. The effort required to distribute this amount of vaccine quickly will come at great personal sacrifice to our teams, planners, immunizers, volunteers, and others. And I want to personally thank every one of them for their unwavering commitment to this effort and their work, which is going to keep Nova Scotians as safe as possible. I'd like to talk a bit about the Moderna vaccine. We have heard some people saying that they want to wait, instead of getting Moderna vaccine, that they want to wait for a second dose of Pfizer. I need to reassure everyone that there is no substantive difference between the Pfizer and Moderna vaccines. They are both mRNA vaccines and are both very effective at preventing COVID-19 symptoms, severe illness, and death. The only real difference is that in these vaccines is that they were made by two different companies. The National Advisory Committee on Immunization says that these vaccines are interchangeable. So regardless of which one you got for your first dose, you can get either for your second dose, including if your first dose was AstraZeneca. Until now, we've had more Pfizer than Moderna, but that is changing. If you wait for Pfizer, you risk waiting longer to get full immunity. So please don't do that. Take the first available appointment, regardless of what vaccine you got for your first dose. Take the first available appointment for either a Pfizer or Moderna. They are essentially the same vaccine. I know I've given you a lot of information, but it's all good news. The sooner we can get to at least 75% of Nova Scotians fully vaccinated with 2 doses, the sooner we can get back to normal. The pandemic has not been easy. We have asked you to do very hard things. Staying apart from loved ones has been hard. Working and schooling at home has been hard. Worrying about your business or your job has been hard. And losing loved ones or being afraid you or someone you love will get sick has been hard. But there's nothing hard about getting the vaccine. In fact, it is the easiest thing we are asking you to do. So please book your appointment and get your vaccine. Do it twice so we can put this pandemic behind us. 2 doses moves us past restrictions. 2 doses means reduced or no isolation if you're a close contact of a COVID case. 2 doses means traveling more freely. We are so close to the finish line, but please continue to stay cautious so we can keep moving forward. And I wish everyone a wonderful and safe weekend coming up.
Thank you, Dr. Strang. We'll now take one question and one follow-up in the time that we have for today, beginning with Sarah Plowman with CTV.
Hi, this is a question for Premier Rankin. In light of the fact that New Brunswick has opened up its doors at midnight to the rest of Canada, what is Nova Scotia doing at its borders to ensure that people entering New Brunswick are not sort of getting into Nova Scotia when perhaps they shouldn't be? What will your message be when you meet with the other premiers tonight, especially to Premier Higgs, about what you'd like to see New Brunswick do to make sure that Nova Scotia remains safe?
Well, I hope they have strong border control as they start to open up earlier than the rest of Atlantic Canada. It was my view that we could have had free travel throughout the Atlantic region with no restrictions in place, and that was an agreement of 3 out of the 4 provinces. Unfortunately, I was surprised that their risk tolerance is different than that. So we'll be prepared by June 23rd when we open up. We're discussing now what measures we're going to need to have in place.
Go ahead with your follow-up, Sarah.
And I'm wondering about, we've heard that perhaps there is a possible shortage of Pfizer vaccine. Dr. Strang spoke of how some people are wanting to get the Pfizer vaccine rather than Moderna. Currently in the province, is there a shortage of Pfizer?
No, we don't have a shortage of Pfizer. We were informed yesterday that in July we're going to get a decrease in the expected amount, but we have more than enough vaccine for our needs. It's just that our supply is going to shift to be able, over time, but to have much more Moderna than we have. So that's the message is that it doesn't matter what your first dose of vaccine or what was. Don't wait for a specific vaccine. Take the first appointment that's available for you for your second dose, whether it's Pfizer or Moderna. The 2 are essentially the same vaccine.
Next, we'll go to Heath Doucette with the Canadian Press.
Yes, Premier, I wonder if you could expand on the New Brunswick's opening. It doesn't seem like you're very happy with it. What problems does this create? Because you've got one province that's basically out almost 2 weeks ahead of everybody else in terms of opening to the rest of Canada, which we're not prepared to do apparently until July 14th.
That's right. We're not prepared to do that till much later, and we're closely aligned with Prince Edward Island, and we're hoping that we'll continue to have discussions with all the provinces. We've reached out to New Brunswick and hope to have that discussion with them, but they have the right to make that decision. And we'll have to adapt with our border plan come June 23rd.
Go ahead with your follow-up, Keith.
Yes, for Dr. Strang, I might have missed something off the top there when you said you're now shifting the goal for the vaccine. Is there a new date as opposed to, say, September, October? Where are we now in terms of getting everybody vaccinated because of the increase in vaccine that we're going to get?
Yeah, it's not shifting the goal. It's just simply that our timelines, given the certainty of a vaccine and now the increased amount of vaccine, as I said, we started off at the very beginning. We were anticipating it would be mid to late fall. That then moved up to early to mid-September, and now we're with the vaccine we're getting, and we're going to roll out over the next 4 weeks. We're in the range of, as long as Nova Scotians keep coming out and getting vaccinated, we're now in the space of early to mid-August, when we might actually hit our targets for a second dose, which is several months ahead of where we initially thought. All very good news, but it ultimately depends on Nova Scotians continuing to come out and get not just finish off the first dose vaccination, but everybody coming out and doing their second dose.
Next, we'll go to Blair Rhodes with CBC.
Yes, good afternoon. The 23rd is less than a week away now. How confident are you, gentlemen, that there will be a passport or something in place by that date so that you can be confident that people coming across the border have the vaccines they claim they have?
Well, we're working on a validation program. We're going to continue to have those discussions. As I said tonight, I'm interested in what the other provinces are doing, and other provinces have certain cards and documents they give travelers. So we need to have, I would like to see as much consistency as possible so that there's documents that we can all count on. But we'll continue to have that discussion, and we'll have something in place. And June 23rd is fast approaching, but that's why we're starting with the Atlantic region, because we have common epidemiology, and it's much lower risk than the rest of the country.
Go ahead with your follow-up, Blair.
There was a Canadian who tried to buy tickets for a Broadway show in the last little while, and they were denied because the vaccine they had was AstraZeneca. My question to Dr. Strang, do you have any concerns that those of us who've been vaccinated with that particular vaccine will have limits on where we can go and what we can do going into other places that do not currently recognize AstraZeneca?
So I'm surprised to hear that AstraZeneca has been a major vaccine in the United States. So they're all good vaccines, and some of them have differences, but certainly they're all have been approved both in Canada and the United States. So I'm not sure why businesses would be distinguishing on the type of vaccine that people have received.
Next, we'll go to Jesse Thomas with Global.
Thank you. Keeping with the border, I'm just wondering, when we fast forward to July, where we plan to open to Canadians, what will that look like for travelers from other jurisdictions coming into Nova Scotia? Will they still have to isolate for 14 days, or what will be the requirements and the expectation then?
Yeah, we're still working exactly on that. We've said all along that when we reach a certain point where we have enough two-dose coverage of Nova Scotians, that we can start to modify people's quarantine requirements based on their vaccine status and testing. Exactly what that looks like, we're still working on that, and we'll provide those details when final decisions are made. But certainly that's critical at some point, and then we start to move away from that 14-day quarantine requirement. But it requires proof of immunization and perhaps some additional testing as well.
Go ahead with your follow-up, Jesse.
Thank you. I guess just looking at New Brunswick and how they're allowing Canadians in from other provinces, do we have a plan to look at next week on how we determine who's coming in from New Brunswick? That's obviously coming up quick.
Yeah, that's what we're working on. So we found out about this the same time you did, and we have calls in to figure out what their border plan is. My understanding is they require one vaccine for those travelers, so I'm eager to know more about their plans.
Next, we'll go to Madeline Bisa with All Nova Scotia.
Good afternoon. This question is for the Premier. I'm just wondering if you could explain more of how the logistics of New Brunswick opening to the rest of Canada is working. Are you still planning on opening to New Brunswick on June 23rd with no restrictions? And if someone goes to New Brunswick now, can they come back on June 23rd and not isolate?
So that's the what we're working on to figure out what exactly the border mechanisms that we'll have in place for June 23rd. As of now, that's the plan. Atlantic Canadians will not have to self-isolate when they come here.
Go ahead with your follow-up, Madeline.
Thank you, Premier. I'm also just looking for some clarification on reopening dates for Nova Scotia to the rest of Canada. As you've mentioned, July 14th is tentative reopening, but the government website also mentions June 30th. What's the difference between these two dates? Is it just have to do with isolation requirements, or is the June 30th date out the window?
So June 30th is the expected start date for Phase 3, and that's when you have that travel allowed from Atlantic Canada, and we have some travel that's permitted even starting in Phase 2. If you have a seasonal property, you are allowed in subject to isolation requirements, but it's not until Phase 4, which is projected to be July 14th, that we are officially going to allow travel from other countries. But we always said we will be flexible with looking at Phase 3 and 4, and that's weeks away. So things can change, and we're hoping that the vaccine rollout continues to expedite, and we may make some modifications, but that's the projected dates right now.
Next, we'll go to Stuart Peddle with the Herald.
So my first question is for Dr. Strang regarding restrictions loosening up when people get their second doses. Are we going to be looking at things like people who have had 2 doses being allowed to not to go without masks, that kind of thing? What are the anticipated restrictions easing plans for those situations?
Yeah, so we're starting point is we're just in the process of implementing now around close contacts. So if somebody is identified by public health as a close contact, we're going to start to accommodate their vaccination status. So if you've got 2 doses of vaccine, even if you're a high risk contact, you're probably not going to have to isolate. So that's our starting point. So, and then we're also going to start to look at all our other measures like masking, etc., and how we start to relax those. We're having national conversations at my level around that to try to get some consistency. But also we need to be cognizant of that until we get good 2-dose coverage with vaccine, that we still need to have many of these public health measures in place. But I emphasize the close, how we're going to start to treat contacts differently based on vaccine status. It's another reason why people should be looking to get vaccinated. Along with protecting themselves and each other, we're going to start to see things that you'll have less restrictions if you have 2 doses of vaccine versus 1 or 0.
Go ahead with your follow-up, Stuart.
So perhaps the Premier might be able to answer this one. Of course, we had the tragedy of Kai Matthews, who died of meningitis B, apparently, but had been turned away or treated as if he had been a COVID case. I wonder if you have any comment on that tragic situation.
Yeah, it is tragic and close to my neighborhood, and my thoughts go out to the family impacted. The minister, I believe, may have spoken to this earlier after Cabinet. We will be undertaking a quality review of the situation.
Next, we'll go to Zane Woodford with the Halifax Examiner.
Hi there, thank you. Dr. Strang, have there been any further cases tied to St. Joseph's Alexander McKay Elementary as a result of the mix-up earlier this week?
So, no, that we've had the 2 cases that were in that school, and we just, as opposed to, that was the only, the mistake was that we, late in the evening weren't able to validate the right name of the school. But since then, all the right things are happening with the school, communication to the school community, and no additional cases at this point that I'm aware of have been identified.
Go ahead with your follow-up, Zane.
Thank you. And on schools again, has there been any spread in schools themselves since they reopened, or are the cases we're seeing tied, back to other members of those families?
We're seeing now some of our, a few of our cases that in the last couple of days who are identified, close contacts of previous cases. A few of them are students who have been identified in the same classroom, have been isolated and are testing, and now they're testing positive. But the fact that they're testing positive as they're isolating means that there's been no further exposure. And that's been the case all along. Most of our cases in schools, students or teachers, have not resulted in secondary cases, but we have had a small number of secondary cases.
Next, we'll go to Victoria Walton with the Coast.
Thanks. Dr. Strang, I'm wondering, how closely we'll be watching the epidemiology in New Brunswick over the next couple of weeks, or the next few days, actually, just until the 23rd. Is there a chance, based on their epidemiology, that we won't be able to reopen to New Brunswick on the 23rd and have to walk that back?
We'll certainly be watching their epidemiology closely. It could take up at least 2 weeks to see the impact of their opening yesterday. So, just because we may not see anything by the 23rd doesn't mean that there may not be something down the road beyond that. So, but certainly we'll be watching closely what happens in New Brunswick, and they certainly are introducing a higher level of risk into their province, and we're watching carefully the potential impacts on their province, because that has implications for us.
Go ahead with your follow-up, Victoria.
Thanks. And in terms of rebooking appointments for earlier, lots of opportunities there for people. Do you have any numbers of what percentage or how many people have rebooked their appointments once it's available? Are there any specific age groups or demographics that are rebooking more or less than others?
No, we've gone out again. We're starting by ages, our whole approach. So we're the people who are getting the first opportunity to rebook, of course, are going to be in the older age groups. And the number, we've had 200,000 Nova Scotians to date have been given that opportunity to move their appointment up, and 75% of them have done so far. And we'll continue to invite people who had an email. They'll get an email invitation, and we'll go into younger age groups over the next few weeks, inviting them to move up. If people have not given an email, we have a 1-877 number that's on our website that people can phone and either move their appointment out through that, or provide an email, which is the preferred approach, doing everything by email.
Next, we'll go to Chelsea Gould with the Truro Daily News.
Hi, this is for the Premier, I believe. New Brunswick Premier Blaine Higgs has said he's confident about moving through phases based on benchmarks and not dates, and they've moved through their first 2 phases within days. We've reached the 65% first dose target for phase 3, but like you said, Nova Scotia has a more cautious approach of the 2-week buffer. I'm wondering, what are your thoughts on New Brunswick's approach on moving phases as soon as these benchmarks are reached, and do you feel more confident in Nova Scotia's approach?
I'm not going to comment on other provinces. They get advice that I'm not privy to. I can just say that the strong public health advice that we have here allowed us to create a plan that's based on the science and the very clear epidemiology, and the 2-week period. It was an important piece for us between phases. So even though we have benchmarks, just because you hit them doesn't mean that you sacrifice the 2-week incubation period. As Dr. Strang just said, when something happens, you won't know the full impact of easing restrictions for a couple of weeks. So I'm very confident in our plan, and we're going to stick to our plan.
Go ahead with your follow-up, Chelsea.
Thank you very much. Dr. Strang, just back to that 75% of eligible people rescheduling their second dose. Is that amount enough of an uptake for you as we move through the age groups, or would you like to see a higher uptake?
We want 100% of those for folks. That 75% I just used is those of the 200,000 who got an email inviting them to move their appointment up. 75% have done so. Now, the rest may be choosing to wait, but I would encourage everybody when they get the opportunity is to move their appointment up. You can get, a number of weeks, 3 to 5 weeks. I personally was able to move mine up from August 3rd to June 28th. So that means I'm going to get my second dose protection, and I'm fully protected 5 weeks earlier. The more Nova Scotians we can get with 2-dose full protection, and the sooner we can do that, allows all of us to be safer as we reopen, and allows us to reopen more broadly. So I would encourage everybody when they get the opportunity to use that and get your appointment as soon as you can.
Next, we'll go to Pat Healy with the Laker.
Hi, this question is for Dr. Strang. What would have to happen to concern you in New Brunswick and our other Atlantic provinces to implement restrictions back on those places for coming into Nova Scotia?
So we're watching for significant increases in their case numbers, outbreaks, and especially if they've identifying those were related to the Delta variant. So our epidemiologists in the 4 Atlantic provinces, they talk on a weekly basis, and we've asked them they're going to continue to do that, and we're watching each other's epidemiology very carefully.
Go ahead with your follow-up, Pat.
Also for Dr. Strang, what would you tell people who want to reschedule their second doses but are having issues with the system and trying a busy phone line, so they're getting increasingly frustrated with the situation?
So first of all, I would say if use your email, and if you don't have an email, phone the line. The vast majority of people are having very good experiences. But when we opened it up for the first time a few days ago to rebooking, there was a lot of people doing that, and so our system can only handle so much volume. It does require a little bit of patience. Again, I'll use my personal experience. It took me 3 days of trying to get in to boom my appointment up, but I just kept trying, knowing that lots of other people were there. The other message is though, that if you haven't gotten your email notification to move your appointment up, do not go on the website just to try it out. Because when you're on there doing that, what you're doing is blocking other people who are trying to get on to legitimately move your appointment up. Wait till you get your email and then go on and reschedule. Let's do this in a patient, sequential way. Everybody will get their opportunity.
Next question will go to CBC's Carolyn Ray.
Hi there. My first question is for the Premier about communication. There was a recent Freedom of Information request from the NDP to your office. It was looking for correspondence on topics including childcare for essential workers, budget implications of COVID expenses, and COVID case reporting. That request yielded no records. So we're wondering, how can it be that no one from your office has been communicating with senior government officials in other departments on this topic?
Well, we communicate every day. We have a 12:30 phone call. We have virtual meetings. Anything that we need to provide that's documented will be provided. We're adhering to the FOIPOP Act.
Go ahead with your follow-up, Carolyn.
So does that mean you're communicating verbally instead of using email or doing written records? Is that an instruction from your government to avoid written communication?
No, not at all. We have telephone meetings where we can talk about the epidemiology in detail, and obviously, like all Nova Scotians, Zoom and Microsoft Teams has been more common instead of meeting in person. So there's in-depth conversations about where we need to go, and that's how we've been dealing with COVID over the span of the pandemic.
And that's all the time that we have today for questions. Go ahead, Premier.
Thank you, Chrissy. I know it's Thursday, but the weekend is fast approaching, and hopefully the weather will cooperate as it has for the last 2 weekends. This phase is about reopening and reuniting, but don't let your guard down. We are not completely through this. We opened up a little, but our plan is a cautious one. We keep following public health protocols. Book your vaccine, and I know that many of you, most of you, have received your first dose, and a lot more of you are looking at now doing your second dose. So don't forget to get tested, and before I conclude, a big thank you to Nova Scotians. It wasn't that long ago that we had to lock down, And a month later, we've been gradually reopening, and that's thanks to all of you. So we won't see you until next week. So have a great weekend, be kind to one another, and enjoy Nova Scotia. You deserve it.